My name is Richard Blake Kline, and I'm an interventional pain management anesthesiologist, and we are here in Conway, South Carolina at Atlantic Coast Spine and Pain Center. Well, we started about 10 years ago, and most of the stuff we did was really simple office procedures. And, it would get to a certain point to where we'd hit our limitations on what we were able to do for the patients. And then so as we advanced and began finding new ways of treating our patients, spinal simplicity became a very important part of that. We were able to minimally invasively treat spinal stenosis with neurogenic claudication with just a simple procedure through a 1-inch incision done at the surgery center under heavy sedation and local anesthetic. And we had great responses to it. And the patients have been very happy with that, and it's been very exciting for our patient population. We've had quite a few patients that have done very well, and that's very exciting to us. We've had so many patients who could not walk very far. They could only walk to the mailbox and back maybe, and they have to sit down for a little while before they can start feeling better again. And then they go on with their lives. And then we've had the patients that we've treated have been able to walk normally without having to sit down. They can continue their lives and go on and do things, go to Disney World with their grandkids. And it's just been a wonderful addition to our practice. And I think it has drawn in a lot of patients that we can treat minimally invasively that don't have to typically go through a more major spine surgery. Well, it's a procedure we do have to perform at the surgery center. I think it's really just added another level of treatment that we can do that benefits the patient. Our practice runs very smoothly, but it's something that we look to identify now, where before we really didn't necessarily have an option for it. If a patient had some instability in their spine as well as spinal stenosis, then it really wasn't something that we could treat. Now we can, and that's very exciting.
Minuteman is a lateral transverse arthrodesis, which means that it gets inserted from the side. It goes across the vertebral processes of the lumbar spine and is designed to fuse that level. And so our goal is to effectively put a doorstop into that spot and prop the space open and keep it open for patients with spinal stenosis who typically present with pain in their back and legs. It's worse when they're standing and walking. It gets better when they're sitting and bending forward. The shopping cart sign is something that we often look for. They'll say, I go to the grocery store and I find myself leaning over, or I'm more hunched throughout the day. And the goal is to physically open up that space, keep it open, and hopefully give them a better quality of life and lower pain overall. The goal of the Minuteman procedure is to get sustained long-term benefit. We're looking for more than just a couple of months. We're looking for years of relief and functional improvement. Working in pain management, a lot of the stuff that we do is managing chronic pain, right? We're doing epidural injections, ablations. These things are effective, but they kind of have a shelf life, right? They last 3 months, 6 months, a year, and patients are coming back and repeating them. And so if they are a candidate for a Minuteman, for a procedure that can provide long-term relief, then our goal is to recommend that procedure for them and give them insight that we can prevent you from having to come back so often and do these procedures that don't last, or we can hopefully give you something that will provide you multiple years of relief.
Our goal in all of our patients is to get their freedom back, to get their life back, to get it to where they can move and do things that they enjoy, to once again experience life. Whereas so many of them, they get to a point they're hurting so bad when they stand and walk, they have no life. And this has been a liberating experience for so many of our patients.